Unit 1. Health and Illness. A. Asking about health. Health is the state of the body. When doctors want to know about a patient's usual health, they ask questions such as, what is your general health like? How is your health generally? If you are in good health, you are well and have no illness or disease. If you are healthy, you are normally well and can resist illness. If you are fit, you are well and strong, not ill, healthy, fit, in good health, very, very well, fit and well, ill, unhealthy, unfit, unwell, not well, not very well, poorly, in poor health. B. Sickness. Sickness has a similar meaning to illness. It is also used in the names of a few specific diseases. For example, sleeping sickness and trouble sickness. Patients also talk about sickness when they mean nausea or and vomiting. Patient says, "I was sick this morning." Possible meanings: I was ill this morning. I felt unwell this morning. I vomited that this morning. I feel sick. I feel ill. I feel unwell. I am nauseous. I feel the need to vomit. The combination sickness and diarrhea means vomiting and diarrhea. C. Recovery. When patients return to normal health after illness, they have recovered. We can also say the patient made a good recovery, the patient made a full recovery, or the patient made a complete recovery. If a patient's health is in the process of returning to normal, the patient is improving. The opposite is deteriorating. We can also say that the patient's condition improved or deteriorated. In speech, we often use the verb get to talk about change. Get over an illness to recover. Get better to improve. Get worse to deteriorate. If a patient is better but then gets worse again, the patient has relapsed. Another word for improvement, especially in recurring conditions such as cancer, is remission. He got over he got over the illness very quickly. 2 years later, 2 years later, 2 years later, she remains in complete remission. Unit 2. Parts of the body. 1. A. Parts of the body. Most external parts of the body have ordinary English names as well as anatomical names. Doctors normally use the English names, even when talking to each other. There are a few exceptions where doctors use the anatomical name. These are shown in brackets below. 1. Jaw, mandible. 2. Neck. 3. Shoulder. 4. Armpit, axilla. 5. Upper arm. 6. Elbow. 7. Back. 8. Buttock. 9. Wrist. 10. Thigh. 11. Calf. 12. Leg. 13. Chest. Thorax. 14. Breast. 15. Stomach, tummy, abdomen. 16. Navel, umbilicus. 17. Hip. 18. Groin, inguinal region. 19. Knee, patella, kneecap. 20. Shin. Limb means arm, upper limb, or leg, lower limb. The trunk is the body excluding the head and limbs. For a more detailed diagram showing parts of the body, see Appendix 1 on page 130. B. Referring to parts of the body. When patients speak about When patients speak about their problem, they often refer to a part of the body. I am having trouble with my hip. I am having trouble with my shoulder. I am having trouble with my knee. The doctor often needs to ask about a part of the body. Do you get any pain in the chest? Do you get any pain in the stomach? Do you get any pain? Do you get any pain in the back? Do you get any pain in your chest, in your stomach, or in your back? C. Describing radiation of pain. A patient is telling the doctor about his back pain and the parts of the body it radiates to. It starts in the back, then it seems to go into the right buttock and down to the back of the right thigh to the knee. Unit 3. Parts of the body 2. The abdomen. The main organs of the body have ordinary English names and doctors use these words. But when an adjective is needed they often use an anatomical word. For example, we can say disease of the liver or hepatic disease. Some abdominal organs, for example, the pancreas, have no ordinary name. Right kidney, liver, gallbladder, gallbladder, duodenum, pancreas, stomach, spleen, left kidney. When doctors talk about the main parts of the digestive system, they use the words bowel or intestine. The small intestine is the small bowel, the large intestine or the large bowel. When speaking to patients, doctors may refer to the anus and rectum as the back passage. B. The chest. The chest, or thorax, contains the organs of respiration and the heart. The main parts of the respiratory system are the airways and the lungs. The left lung is divided into two lobes, the right into three. The airways consist of the larynx, the trachea or windpipe, the right and left bronchus, and the bronchioles. The chest is separated from the abdomen by the diaphragm, the pelvis. A doctor is explaining the function of the bladder to a patient. The bladder is situated in the pelvis, as you know, and it is connected to each kidney by a long tube called the ureter, one on each side. The ureters carry the urine from the kidneys to the bladder, where it is stored until you decide to empty your bladder. When that happens, the urine passes down another tube, called the urethra, to the outside. Unit 4. Functions of the body. A. Eating. You are hungry. You are in a restaurant and the waiter brings for your food. You smell it. It stimulates your appetite. You want to eat. Your mouth waters, filling with saliva. You take a bite of the food. It tastes good, and you chew it and swallow it. You can eat more, but then suddenly you taste something unpleasant. You feel nauseous. You rush to the toilet and get there just in time before vomiting all the food you've eaten. Something has disagreed with you. B. The five senses. In addition to smell and taste, the senses include sight or vision, hearing, and touch, also called sensation or feeling. To ask about the senses, doctor used the questions: what is your sight like? What is your hearing like? What is your sense of smell like? What is your sense of taste like? Is your sight normal? Is your hearing normal? Is your sense of smell normal? Is your sense of taste normal? To ask about sense of touch, doctors talk about knobs, loss of sensation. Have you noticed any knobs in your fingers or toes? C. Other functions. Function. Function. Speaking. Verb. Speak. Noun. Speech. Walking. Walk. Gait. Breathing. Inhale. Breathe in. Take a breath in. Breath. Respiration. Exhale. Breath out. Breath. Urination. Urinate. Urine. Micturition. Micturate. Urine. Micturition or urination. Pass urine. Pass water. Urine. Defecation. Defecate. Faces. Pass faces. Pass stall. Stalls. Menstruation. Menstruate. Have a period. Menstrual period. Monthly period. When taking a history, doctors can ask, do you have any trouble walking? Do you have any trouble breathing? Do you have any trouble passing urine? Do you have any trouble with your speech? Do you have any pain when you breathe in? Do you have any difficulty walking, breathing, passing urine, or with your speech? Do you have any problems with your speech? Do you have any pain when you breathe in? When a school touting a patient's lungs, the doctor tells the patient, take a deep breath in, hold your breath, then breathe out completely. Less common functions. There are some things we do less often. When we are hot, we sweat. When we are nervous, we shake. When we are sad, we cry. Doctors can ask, do you sweat more than usual? Do you shake more than usual?